Hello, friends. This is going to be another one of my little makeshift videos here. I wanted to update you about my daughter Doni. Um, we're in the for those of you who don't know, Doni was diagnosed with something called premenstrual dysphoric disorder back in December of last year. And so her periods are very hard for her because what it does is it throws you into a clinical depression every time you have your cycle. And my daughter also has autism and mental retardation and diabetes. So her little world is easily rocked by anything. And we had a good night last night, but because we're approaching what would be her cycle time, she's been having some troubles. Like like I said, we had a good night last night, but the night before that and the last two nights before that, the baby girl, I swear, she screamed. I mean, and when I say scream, I mean screamed from the evening on into the wee hours of the morning. I don't know if you can hear her in the background, but that's her right now. There's nothing we can do about it. Um, if she's calm enough when she has these attacks, I can tell her, we love you and you're safe, and she'll kind of stop screaming and crying and ingest that. But if she's especially agitated and volatile, um, any attempt to help her in that respect will only agitate her further. And I was gonna, if you noticed, Mel and Angie, if you noticed in my video yesterday, I there was a blip at the end where I had obviously cut the spliced the audio, and that's because I had started to talk about Doni, but it's a serious issue with Doni, and I didn't really want to put that in a video that was mostly lighthearted and silly because it just didn't feel right to me. But anyway, we met with her psychiatrist yesterday. She's got a whole month full of doctor's appointments this month. She's going to see the endocrine people next week. That's for her diabetes care. She's going to have a full physical on the 20th because a friend of mine was saying, for all you know, since the gynecologist, when she prescribed the depot shot for the PMDD, she didn't do a full pelvic exam. And so, for all we know, she might have cysts on her ovaries or something, So we got to get her in for a full physical to make sure that nothing is wrong, because she can't really tell us if she's experiencing, she can, but it's so hard to gauge if she were to exclaim that she were in pain or something, because so much of what she says is just echolalia. We don't know if her saying tummy hurting is just menstrual cramps or if it's something more serious or what. So we're going to have a primary care just completely look under the hood and see what's going on. Make sure she's okay physically in every respect. She had the dentist recently and had 2 cavities and got those taken care of. So yeah. She'll also see the neurologist at the end of August, and that's for her the 2 seizures, or the two days when she had seizures during this year, in January and in June. And we're not seeing chronic seizure behavior, so that's a good thing. So he probably won't prescribe anything for her, but she needs to be seen. She had an MRI and some other testing done, EEG of the brain done, and all of that was normal. So we're not looking at epilepsy or anything like that. But this morning, she had her green pancakes. You know, Dr. Seuss liked green eggs and ham, and Donnie Girl likes green pancakes. So she did eat a fair amount, and it's always good when she eats because that means that she's more stable and not depressed. Um, and yeah, that's my update on my baby girl. So I will roll out a little video to this, and I appreciate everybody's support. And anyway, yeah, thanks, and I'll talk to you later.